Hello, everyone. All right. Some of our morning folks, remember we've got to bring that energy. I know that we, usually after we eat, we're a little bit more on the chill side, but I'm going to ask that you please dig deep for some energy this morning as we discuss a very important topic. Thank you for joining us for today's second panel on gun violence, children, and mental health. My name is Dr. Williametta Simmons. I am a psychologist and humanitarian. Again, today's event is hosted as a joint effort by Child Guidance Resource Centers, Diversity, Equity, and Inclusion Council, and our Government Relations Committee. Child Guidance Resource Centers delivers evidence-based behavioral health services and community-wide wellness programs to children and families throughout the 5-county Philadelphia region. With gun violence traumatizing so many children, families, and in many cases entire communities, Child Guidance Resource Centers felt a need to host this event. Today, we bring you panelists who will share their views on the topics and offer ways we can all work together for solutions. Our second panel today includes elected officials from around Delaware County. I would like at this time to go down the line and I have each council person or each panelist introduce themselves. And before we even begin, because we have a much larger panel than we did this morning, we are going to ask that you please keep your responses concise and succinct. So within 2 minutes, because we have a lot to go over and we do want to leave a little bit of time for our audience to ask some questions. Thank you. So we'll just go down the line. There should be 2 mics, so you can go this way, you could go out or in.
Start down here. Start.
There we go. Is that on?
Good morning. I am Dave Deloso. I am the representative from the 162nd District, Sharonville, Darby Township, heading west all the way to Ridley Township.
Hi everyone, Heather Boyd. I'm one of the newest state reps in Pennsylvania, elected in May, and I represent half of Upper Darby, Darby Township, Clifton Heights, Alden, and Collingdale. Glad to be here.
Good morning, everyone. State Senator Amanda Capoletti, 17th Senatorial District in Delaware County, that is Haverford and Radnor Township.
Good morning, Tim Carney, State Senator representing the 26th District in Delaware County. I kind of go from Ridley and the Delaware River all the way over to Marple, Newtown, up to Upper Darby and down to Median Spot.
Elaine Schaefer, I'm Vice Chair of Delaware County Council, and I, along with my 4 colleagues on council, represent the entire county of Delaware County.
Good morning. My name is State Representative Gina H. Curry. You are sitting in my district in the 164th. I represent Upper Darby, part of it. Well, Upper Darby, part of Drexel Hill, East Lansdowne, and Millbourne, and I'm excited to be here today.
Good morning, I'm State Representative Lisa Borowski. I represent the 168th, which is Radnor Township, Newtown, Edgemont, and half of Middletown Township. Thank you for having me for this important conversation.
Hi, my name is Christine Luther. I am also a member of Delaware County Council and a member of the board of Child Guidance Resource Center, so I'm really happy to be here today with my fellow electeds.
Good morning, I'm Leanne Kruger, State Representative for the 161st District. My district includes Aston through Ridley and Middletown Township down to Chester Township and Upland. And I'm going to give you my regrets early. I need to leave at 12 o'clock for a community event in Chester Township that I'm also committed to. So that's why I'm sitting on the end.
Good morning, everyone. Thank you for being here. My name is Dr. Monica Taylor. I'm the chair of Delaware County Council. And along with the other 4 council members, we represent the whole county.
Good morning, everyone. My name is Councilman Richard Womack, and I also serve with the other 3 county councils, and we represent all of Delaware County. Thank you.
Thank you all so much for being here. Can we give them a round of applause? Thank you. We value your time, so we know that it means a lot that you're here today. For the following questions, any or all of you can answer. If you need to respond to a particular question, please just, ask for the mic and it'll be given to you since we have just 2 mics, okay? According to the CDC, in 2021, the firearms injury death rate in Pennsylvania was 14.8 per 100,000, which is considerably higher than the neighboring states, such as New York and New Jersey. Additionally, statistics from 2019 show that Delaware County had the 3rd highest firearm death in the state, behind Philadelphia County and Allegheny County, respectively. Why do you think this is? And are you aware of the gun violence statistics in your particular district?
I'll start. Why is this happening? When we look at our surrounding states and what's happening there, I think it's a really easy question to answer. They have common sense regulations in place when it comes to firearms and guns. They have things like universal background checks, safe storage laws, red flag laws, laws to disarm domestic abusers, strong permitting systems, and for the purchase of and carry of different types of handguns and weapons. So I think that's the why. All other things being equal, they have those pieces in place that we don't have in Pennsylvania. And I can tell you, we're fighting for it. We know in case you don't know, the House has passed some of these bills and sent them over to our state Senate. And right now, the state Senate has chosen not to take those bills up for consideration. And as far as the statistics, I represent different parts, Montgomery County as well as Delaware County. I do have some of those statistics to know that there's been, like, the age ranges and the homicides. I have actual numbers here, but it's pretty staggering when you look at it, to think about the things that we could have in place to help prevent some of these items. So I don't want to read off the numbers to you, but I do know what they are, and it's really disheartening when I know that we have legislation that can prevent those things from happening.
That's all right. Thank you for asking that question. I did ask to see if I could get more details on the statistics in my district. The challenge is they're not kept very well. So our demographics office in the House was not able to provide those for me, mostly because we don't record them and track them as well as we could and should. So that's an important start. I also, before I became a state representative, worked for our congressperson, Mary Gay Scanlon, and we were very aware that there's a large, and I'm sure our district attorney can speak to this more, but there's a large trafficking of guns coming along the eastern corridor. And Delaware County, if you think about our geography, is is on that corridor for that gun trafficking that's happening all along from, Georgia and Florida up through Boston. So we just, are geographically placed in a challenging place for that. And of course, I will say one of the things I'm really proud about on this group is that you have a lot of school board directors that have gone on to do different things, and we're very keenly aware of the challenges that we are facing in school-to-prison pipeline challenges, for mental health challenges that we're speaking about today, and just general violence that has escalated among young people over the last decade or more. And we're very aware of those resources need to come into our communities through our school districts and through community-based programming.
Before the next answer, I would just allow this opportunity for Jack to introduce himself to the audience, and then we'll continue.
Thank you very much for the opportunity to be here today. My name is Jack Stolzheimer. I'm the District Attorney of Delaware County, and it's always a pleasure to be in Upper Darby, particularly in Cardington, where my family was raised, and always a pleasure to be here with the Child Resource Center and all the great work that they do to support them.
And as a reminder, we're currently discussing why Delaware County is the 3rd highest, or has the 3rd highest firearm death in the state.
I just wanted to point something out. I think when people think about gun violence, they focus on crime. one of the leading causes of death by firearm is suicide. And it is actually 62%, according to the statistics I've looked at, of the firearm deaths in Pennsylvania overall are as a result of suicide. And I think if that sort of demographic, that sort of statistic holds true in Delaware County, one of the issues is gun ownership. And I think there is a culture of gun ownership in Delaware County going back a long time. There are a lot of areas in the county where people use firearms in recreation, even just legal gun ownership, appropriately purchased gun ownership. So I just think it's important that when we think about gun violence statistics, we understand we are not just talking about crime, we are talking about mental health. And I think if you add into the suicides the number of deaths that result from domestic violence, it would be a very, while that is clearly gun violence and a crime, it is also something, when guns are present, legally or otherwise, in a household and there's a dispute that turns violent, somebody's far more likely to die, even than with a gun, with a knife or other type of weapon. So it's important to understand that mental health is a key driver of gun violence here and elsewhere.
As a reminder, because of the size of our panel, I promise I won't do this again. We're just asking that everyone try to keep it within 90 seconds to 2 minutes. Thank you.
I'll do it in less than that. This isn't a popular stance, but when I think about the statistics on gun violence here in Delaware County, I always think about children. Right around the corner from here, my first incident was a young man who was 14 years old, ready to go to high school, was killed in a friend's basement. And so when I think about, gun violence in Delaware County, oftentimes, I know growing up in Baltimore, you would say, because Baltimore had high gun violence in the 80s, right, really high. And people would say, oh, you live in a county, so it's safer out there in the county. This isn't popular, but our kids don't feel safe here in the county. They feel like the corridors are unsafe. And I just had something in my district yesterday that's still under investigation, but with school-age children. So when we think about, I don't have the statistics on what's happening with the children. We know in Philadelphia it's extremely high, but I promise you, the statistics here with children who are feeling unsafe and the need to feel armed and the need and the availability of guns to them is a definite issue.
So I think everyone on this panel and in this room we're all aware of the horrible statistics. And it's shameful. And it's true, access to guns and gun culture are part of it. But the more systemic and harder to change part of the reason for it is decades of lack of investment in the underliers, in housing, in all of the social determinants that in mental health facilities, in economic development, so that we can provide jobs. These are just societal issues that in Delaware County, for decades, we did not invest in adequately, and we're paying the price. And it's showing out in all kinds of ways, but one of them is the gun violence. But on a more positive note, I'd like to say that look at this panel here. This is an incredible showing, which really, I think, signifies how deeply we all care about this issue and about solving the underlying issues that are causing it.
First of all, I want to say I concur with a lot of my colleagues up here on the panel. Mental health has really grown, and it has really taken over our youth. The way they think the way that they deal with life and how they look at life has really played a major part. You'd be surprised in how some of our young people in the homes that they live in, sometimes they don't have the parenting that they need. They don't know how to get a decent job. They don't have the training most times or the skills. So when you basically tell someone that, oh, you're not qualified, the next step is, well, what do I do? How do I survive? And they have a hard time just dealing with life situations. And I think that we need to provide more training, more education, and look at the housing areas and making sure that they can have a decent living will help cut down on some of these violence. And, you know, they struggle within themselves. And I think that's why you see a lot of increase of violence. One, because of mental health issues, because they don't have educational skills, because of sometimes of where they're living and how they're living is playing a major part. And I think that's why you see the way the gun violence really grows.
I'm a base level person, and I think a lot of the struggle with gun violence is the fact of, or the thought of general despair. There's nothing there for me. I'm going to live a life of violence. I think the abandonment of the industrial complex employers of base level training, and when the employers throughout the 1970s, 80s, and 90s abandoned their base level training and started to pressure it onto the public school system. In other words, send me a welder, send me a mechanic. I don't have time nor money to train. I no longer want the burden to train. And our public education system just isn't prepared for that. You know, my father-in-law was a refinery worker with a basic education, a year of algebra, started out on the canning line in the labor group, and worked his way up to be a director. That no longer happens. And I think corporate America has changed the fabric of the society, and it demands too much of our public education and demands too much of entry-level employment. Therefore, it leads to despair, especially in some of our school districts that struggle. And when there's no looking forward, and we have a problem with desperation, and we have a problem with recidivism, and we have a problem with housing and public transportation, there's nothing left but violence. So it's my endeavor to, I guess, make corporate America a little more responsible for what they're actually responsible for. You know, training is the burden of the employer. It's not the burden of our public schools. It's not the burden of our parents. And it shouldn't be thrust upon us.
Thank you. Anyone else before we move on to the next question?
So I was just going to add, you know, certainly all the points up here that have been made are absolutely true. I think one of the other points is it's sad that this has become such a political issue. I've met with so many advocates since I've been in office, but even prior to that. So I was a commissioner in my township, and we had a gun death due to domestic violence. It was shocking for the community, and people rallied, and at the time I thought, oh, I'll pass my own gun law in Radnor. I was the president of our board of commissioners. I thought, oh, I'll do this, and my solicitor came and said, you can't do that. But I think it's sadly become such a political issue, which is why we can't get anything moved here in our own state. And you know, I really believe that we need the federal government to make, put in place the gun safety laws, because when you push it down on the state level, we just can't get it done. Some can, but some states just can't get it done. So, you know, I think we need to take the politics out of this, and we need for people to realize that people are dying across our counties, our states, from all sorts of, due to all sorts of issues, but because people have a gun in their hand. So, sadly, the police officer that lost his life early last week or 2 weeks ago, those criminals, they would have just been stealing a car, but because they had access to a gun, they ended up killers. So, I think we need to take the politics out of this. We need for people to come together and to realize that, this is a crisis situation and we're losing people at every socioeconomic level, at every, across every culture and every race in our community.
Thank you so much. I really appreciate the diverse perspectives on this issue in terms of what could be done, especially for Delaware County. I grew up here. I love Delco, and just even in the last 30 years, but definitely the last 10 years, there's been a change in the fabric of Delco, and you can really see it. So what you all are touching on with regards to addressing gun violence, I think is exactly what we need at this time. Now, what do you think works and has worked to reduce gun violence, whether that be specific initiatives, pieces of legislature, so forth and so on? What works or what has worked? And anyone could answer. 1 to 2 minutes, please.
In the House, we have passed, finally, 2 pieces of common sense gun safety legislation. When I was elected 8 years ago, I held the first policy hearing on universal background checks, which we know works in other states and keeps guns out of the hands of folks who should not have guns. Jen O'Mara has been a long champion of the extreme arrest protection order legislation, which again, we know has cut suicide rates in other states where this legislation exists. So in the House, we had a package of 4 bills. 2 of them passed, 1 failed on the floor, the other one got pulled because it was going to have the same result. But those are 2 pieces of legislation that have broad bipartisan support. When you talk to average citizens in Pennsylvania, it's just that getting enough votes, particularly in the Senate, is a challenge right now. And in my district, you asked about statistics. I don't have district-wide statistics, but I can tell you that just a few weeks ago, a first responder died by suicide in my district. He was a Philadelphia firefighter. He was a resident of Rep. Carol Kazim's district, and he was in Aston when he died by suicide, and my local police responded. That's heartbreaking. And anything that we can do to get guns out of the hands of folks who are a risk to themselves, as Christine said, is really important policy work.
Thank you for using the correct terminology, died by suicide as opposed to committed. It means a lot to those of us that fight for that particular cause. Thank you so much.
So as Leanne and other people have said, can you guys hear me? There are multiple ways, multiple aspects of the gun violence problem in the United States. There's the suicide issue, there's the gun safety issue, there's the children who come in and commit mass suicides in schools, and then there's the crime issue, people who use guns to commit crimes in our communities. There are different ways we can address each one of them. What we've done as a district attorney is I've worked as a federal prosecutor on a program that has 27 years worth of evidence to support that it can stop violence in our communities. It's called focused deterrence. When I got elected district attorney 4 years ago, I decided to bring that program to the city of Chester, which had been one of the most violent small cities in America for the last generation. That's why we put a third number of gun violence issues in the Commonwealth. What we've been able to do is bring the community and the police together around the 1% of people who commit 75 to 80% of the violence. We offer them a chance to get out of that life, and if they don't, we're going to hold them accountable. And in the last 3 years, we've run the most successful gun violence reduction program in the Commonwealth. Shootings in Chester are down by 65%, and the gun homicides are down by 68%. There is a new day in the city of Chester, and we can do this and have done it all over the country. This program was really working wonderfully in the city of Philadelphia when Seth Williams was a district attorney. So you need a district attorney who believes in it. You also need some police who understand the benefit of community policing, and need local elected officials like we've had here on this panel, particularly my friends who are on Delaware County Council and who funded this program at the very beginning to get us started. We can do these things all across Delaware County. We just have to take it one bite at a time. But there are programs that work. There are gun safety programs that work. When I was a federal prosecutor, one of the things we did across the country, every federal district had to have a gun safety program. And if you're in a rural community, right, what you have to focus on are suicides and gun safety. And so what those U.S. attorneys' offices did were focus on getting gun locks out to people. You can't imagine how a gun lock can change the trajectory of a family's life if that gun is safely stored. And just so everybody knows, there's about 390 million guns. That's the estimated number of guns in this country right now. Right? There's 330 million people, so there's 60 million more guns than people. About 1/3 of the people in this country own those guns. So most guns are kept completely safe, but some don't. And with that number of guns, it presents a threat to all of us in our society. So the problem of people who shouldn't have access to guns getting access is something the legislature tries to do something about. It's very difficult. But we, with their support on the ground, are also making sure that in law enforcement perspective, we're doing everything we can to stop the violence in our communities as well, in partnership with our legislators. And everything, by the way, Dave DeLoso just said is absolutely true. This is all caused, and you should know this, communities with high levels of violent crime, that is the symptom. The disease is poverty. Okay, and this began in the 1960s when we stopped investing in our communities. We stopped investing in urban communities across this country and we sent those jobs overseas. Well, guess what? Violent crime took its place. We've got to, as a country, as a Commonwealth, do what we're trying to do here in Delaware County, which is address it head on.
Thank you, Senator. I just wanted to comment real quickly on the problem in the Senate in Pennsylvania. But I don't think it's a surprise to anybody that the House was able to pass at least 2 of the 4, but they could only do that when they actually had the Democratic majority in the House. And I'm not trying to make this a political thing, it's just an observation really to look at things. In the Senate, we have kind of broad support for those 2 bills to actually pass. The Republican chair of the Judiciary Committee has said that she will have a hearing on it if she's allowed. The way the Senate works, the rules are such that the President Pro Tem and the Majority Leader control everything in terms of legislation, in terms of what moves and what doesn't. We were hopeful at first when they actually assigned it to a committee, because sometimes they don't even do that. But it's obvious that they are preventing the bills from even having a hearing in the Judiciary Committee in the Senate. So why is that? You know, if you think about it, because certainly the red flag laws and the background checks have broad support across the Commonwealth. 72%, I believe, was the last thing I heard from the general public about these kinds of bills. And when you talk to responsible gun owners, they're all in favor of it as well, because they're responsible gun owners, and they're not the problem. The problem really, you know, comes down to the money and where the money is going and where it's coming from, and all signs lead to the gun manufacturers. The NRA is really just a front piece for the gun manufacturers, and that's the real problem. And our laws and our rules are surrounding where we get political donations and how much we get and where they actually come from are very obtuse. They're anything but transparent. So it's very difficult to say, how can something have almost 3/4 of the population in favor of it, but we can't even get a hearing for it in the Judiciary Committee. And the last thing I'll say real quick is that the Republican majority in the Senate right now is only 3 seats. So I think we have our work cut out for us to try to keep this thing moving.
I won't be long. I was on a panel yesterday about children's health with a superintendent from Kennett Square, a doctor, and somebody that's in the philanthropy piece. And what that superintendent talked about, and to go to Elaine Schaefer's point, Councilwoman Schaefer, she talked about the root issues of what brings us to gun violence, and what he talked about was in a different school district that he used to work for and he wants to bring into Pennsylvania because he came from Delaware, was the community-based health care that gets put up in schools. And not just putting that in the high school though, where he was, they put it in at the preschool kindergarten level so that you were attacking the issues before they become issues. So providing that healthcare space, providing that mental health space. Why is that child acting out in the classroom? There is a reason behind why a child might be acting out in the classroom, and it's often tied to trauma that's happening at home or in their neighborhoods. So the state can better invest into those types of programs to help address at least some of those social determinants of health that Elaine mentioned when she first spoke, and I think that we should be doing that. I'm a huge proponent of that, and addressing some of this stuff from that end before people have a chance to get into violence, and that they can see a path forward for them and not just despair.
I want to just quickly bring up one method that is often overlooked for getting declining statistics for gun violence, and that is the connection between investing in green spaces in a community and gun violence. There's a woman at UPenn named Dr. Eugenia South. She runs the Urban Lab. Look it up. She's done amazing research on the connection between having green spaces, even small ones, in urban environments and the positive effect they have on gun violence rates. It's fascinating. It's also intuitive. If you have a community who is investing in their own blocks, in their own neighborhoods to make a safe place to go, that brings up community morale. It makes children feel better about where they're growing up and more pride in their neighborhood, and it helps in all aspects of their outlook in life. So I just wanted to bring that up because people don't talk about it a lot. It's new research, and we have the woman who is leading this research right here in Pennsylvania at UPenn.
Thank you so much. We have one more. Did you want to add? And then we've got so many questions, and I think we're on question number 2. So we're going to try to expedite the process. Go ahead.
No, I'll add a little bit. I think my colleagues have made several points thinking through the social safety net and thinking through the services and how we create better access within Delaware County to mental health supports, to all of the things that go around trying to help individuals to live a happy and healthy life, whether that's green space, whether that's access to job training, whether that's access to better supports in terms of mental health or substance use disorder. But it's also us working together at every single level of government to create better policies and see how county council can work with our DA to get guns off the street. Right? How can the state legislature help to get guns off the streets? And the more we all work together to do it, the better it is, right? And also thinking through public health and thinking about this as a public health issue. And how do we get data? How do we utilize our health department to also address this issue?
Thank you. We're ahead of the game. We're thinking ahead. All right, now that Delaware County has a Department of Health, does the department have any preventative or educational initiatives that may reduce gun violence? We tapped into some of them. Go ahead.
Well, I just wanted to say, because I know we were talking about the last question, so this might go into it. I know before I became a state rep under the Wolf administration, PCCD, which is the Pennsylvania Commission on Crime and Delinquency, was doing a lot around gun violence, and I was seeing it from Philadelphia, right? So all of these different organizations were getting like millions of dollars and being awarded all this money to like work against gun violence. I'm always looking at PCCD to see what funds are out there. I just want to say the health department is a wonderful thing here in Delaware County, and we are so blessed to have a health department. Thank you, Dr. Taylor and the council. I think, you know, the funding that comes down through to the different parts of the Commonwealth is critical when we're looking at who needs what. So we're here in Delaware County right now, you know, we're always talking on the floor about Philadelphia, right? Philadelphia's DA, Philadelphia. We know that when you're right next door to a place where the gun violence is really high, and the funding goes to those hot spots, but the funding doesn't always come over into the other places, and we're getting that too. I lay in my bed at night and can hear pep, 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 pep over in West Philly, no lie. And I'm like, is this in Upper Darby? Where is it? Is it right here, but it's across the golf course, so you can hear it so loud. And so my point is, with the community health, right, and what Dr. Monica Taylor said about the public health issue, PCCD really needs to be looking at how these programs can really come into the small organizations. How people, you know, you always have to fill out a grant application. One of the things we talk about in our offices is these smaller orgs, they don't even have the opportunity to be able to get this money. So, you know, with the health department, how can we get this funding and work with the council and the state and even the federal government to try to get the smaller orgs that are down on the ground, the grassroots. And I see that happening with the help of the county health department. So.
And just to add to that, you know, as our health department evolves, this is one of the key issues that we would like to target as a public health issue, working with our district attorney's office and understanding that now we actually, because we have a health department, we have access to other funds, to Curry's point, that we didn't have access to before because you had to have a health department in order to apply for CDC funding and think through how this is a public health issue and how we can better combat it. And right now we're in the midst of our evaluation of our public health evaluation for the entire county, so we'll actually have statistics to utilize the target in the future as we move forward with programming. So.
Yeah, just to follow up on that, you know, in my role on the Child Guidance Board, I've become a huge fan of data, and I see Mike here, and you know, it's definitely something that Child Guidance does extremely well in terms of using all of their systems, including systems that are designed for other things, like you know, billing and reporting, to gather data and to enable streamlined reporting on things, and that is extremely helpful, as it's already been stated, and I forget who pointed it out, that we just don't have data in Delaware County. And one of the key things that our health department can do is work to pull together the data sources that will then inform decisions that we make and really help us advocate with our state and federal legislators for the resources to address what we see as root causes or areas of overlap where we might be able to break a cycle of violence.
Thank you so much. This is, again, I think these questions are all interrelated, so it'll run into the other one. And the next question has to do with actions that you think could be taken, right? So what actions do you think should be taken to reduce gun violence in Delaware County? Don't all rush at once.
Well, in Harrisburg, I think the biggest thing that we can do is end the preemption laws that we have. We have laws that basically say you can't have a local law that's more restrictive than a state law. You know, since I got to Harrisburg, it's been beat into my head that one size doesn't fit all in the Commonwealth of Pennsylvania, except when it's politically expedient, and that's kind of what we're seeing. So the inability for Philadelphia or Delaware County or Lansdowne to actually have a different kind of law or different kind of regulation around anything involving guns, and it goes back to my earlier comments about where the money's coming from and where that power originates.
I'll give a few places where we can and should. One, continue the program that our DA is running and replicate that in our other towns and boroughs. Two, invest in our education, invest more in our green spaces, invest in workforce, and invest above all in our facilities to treat mental health issues in young people. And that will equal less gun violence. So that, you know, the bottom-up approach is the way we have to do it. It's not as sexy because it takes a long time, but that is the answer in the long run.
So I will just add to that. One of the things that we are doing in the State House is really looking at mental health funding. We have added hundreds of thousands of dollars. So one of the things that we've added specifically for schools is we added $100 million, I think, yeah, and that will enable there to be $100,000 to go to each school district in the state of Pennsylvania, in the Commonwealth, to specifically address mental health issues in our schools. So that is something that we are working really hard. It is definitely an absolute focus. Something else is, to address domestic violence and issues of domestic violence. We need to help people get out of those situations and provide more support so that people have the opportunity to leave those situations. I have some legislation that I've introduced to help support victims of domestic violence, to help them get out of their leases if they need to, and help them secure their personal documents if they've had those taken as part of domestic violence. So we need to enable and support people as they're working to get out of those situations. And the other thing, and this kind of segues, I think, to one of your later questions, but it's around creating a pipeline of more mental health professionals. I have a colleague in Allegheny County, Rep. Abney, has introduced legislation around the Social Work Licensure Compact. So that will allow practitioners to practice across state lines. So how can we bring more practitioners into the state and help address these issues? So, between myself and all of my colleagues, certainly in the House and the Senate, we are working really hard. And again, I want to echo those who said how exciting it is to see what's happening here in Delaware County when it comes to our health department, and how fortunate we are to have such a forward-thinking group of council people who are looking at these issues from every angle.
Thank you for being patient.
Thank you. I just wanted to say, as you heard our DA Jack all the time talk about some of the programs that we have in place already. One that have worked in Chester where the crime has really went down. And hopefully we will expand a little bit more on the programs. I'll be trying to expand them in other communities and neighborhoods as well. Also, I'd like to say, too, that we need to increase more facilities to deal with mental health. Make sure we have more programs, more people working along with mental health facilities as well. So that's one thing that the county is looking at, is trying to figure out how do we expand our mental health facilities. Now we talk about the gun violence. We all know there is a lot of situations with the gun violence starting from a lot of illegal guns being on the street. You have to get to that pipeline, where these guns are coming from. We have laws in place, and we need to strengthen these laws, and we need to enforce them. Get these guns off the street. And I know our DA's office is really struggling, and he's been fighting with this to try to get some of these guns off the street. If we can get to that source, then I believe that those numbers will really start coming down even more. Because a lot of, like I said, is committed by a lot of illegal guns that's taking place. We look at what we call a ghost gun. I didn't know you can make a ghost gun.
3D printer.
Exactly. So those kind of things that we have to put an end to and put a stop to. And so hopefully we will get more programs, get more people trained to help get these guns off the street.
Thank you so much. Did you want to
So, I know, I'm looking at your questions, and there's a lot around mental health, so we could probably condense them. Really, I'm not trying to tell you how to do your panel. But when I think about, child guidance resource centers, just giving you all a shout out, because in my district alone, I know the two school districts, Upper Darby and William Penn school districts, they're actively a part of those school districts and all the events that we do have. Now, I'm a big one on, the fact that we do not put enough investments in mentorship programs. And so really I want to always come back to the children, because the children are the ones who pick this up and they move forward. We don't have enough mentorship programs. Our programming that was great, Weed and Seed right here, we had so much going on in Upper Darby. All those funds were cut. We also had things like Club Ophelia for young girls, because we tend to try to make this a gender-specific thing. We know that there's young girls who are out here that have guns too, and that will use them and are in this ring. So we really have to get back to making investments. When you talk about gun violence reduction, we have to have the grassroots mentorship programs start with these children young. And I always put into the fact that 4th grade is the grade to start. You want to stop the school to prison pipeline, get in at 4th grade. We talk about reading by 3rd grade, get in at 4th grade, because at 4th grade, these children have phones, they can get on social media, they can have a whole life outside of what their parents even know. And this is for parents who are involved. Okay, so we need to get the funding there.
I love the emphasis on, first of all, you can tell me what to do. I'm very teachable. I love the emphasis on starting young, you know, because I do think that impacts kind of, it lays the foundation for what we see later on as adults and so forth and so on. All right, next question. With the establishment of the new Federal Office of Gun Violence Prevention, how might this initiative provide better resources to handle the problem of on a local level? So with the establishment of the new Federal Office of Gun Violence Prevention, how might this initiative provide resources to handle the problem at a local level?
You may have heard me mumble, it depends. And it's really exciting that our current president has put this federal task force and organization together. It's going to depend on whether it can get funded. And ultimately, you know, the federal government can have huge impacts in what we do locally when they provide guidance and data and then resources. That's what the federal government can often do for us locally, and it will depend on what the political will to fund that ends up being. And we know, as you know, we're in this situation where we feel like the federal government, or at least federal Congress, has been messy and, you know, having a hard time working together, and we feel the pressure then to, you know, respond or act, because, you know, when it's not at the federal level, we have to address it at the state level, but we don't have the resources that the federal government does. So I think it's going to depend on, it's the political will to fund that institution and this new institution that I believe we can do, and I think that the guidance in the administration has a great plan, but it's going to depend on whether we can get resources.
Heather, I'm going to echo what you said, although I'm very cynical. I don't know. Right. But I will tell you, and you know this, our federal representative is doing everything she can, and I just want to give you guys a clue about this. But Monday morning, we're meeting county council, chiefs of police in Haverford and Upper Darby, and I are meeting with the team that she has paid to embed as a pilot project, a mental health crisis team that's been working for the last 6 months with the Upper Darby and Haverford police departments. They go out on calls with officers when there's a mental health crisis in this community. We have, because Mary Gay invested in that, that was a federal official who actually said, what can I do to help make this situation better? She has. And now County Council is going to hear about the success of the program so far, some of the challenges to keep it going forward, and we're going to see if we can continue to take that kind of a model, because so much of this, as we all know, is really about mental health. It's the number one thing that's really changed. You talk to veteran police officers. That's changed over the last 20, 30, 40 years. Is the number of people who are presenting with mental health issues that is driving a lot of the police response. And they are asking for help, and that's why Congresswoman Scanlon listened to us and took some action. So I may be a little cynical about the office, the big office, but I am completely not cynical about Congresswoman Scanlon and her ability to make a difference.
I just also want to add that just recently, you all know about 911. You understand what that does. There's this new system of 988, right? It's the number you can call for mental health challenges and concerns. And our county had the foresight to think about putting that together early on. And that's not happening everywhere. At the state, we just introduced legislation. Our colleague Maureen Madden introduced legislation to do more to see how those organizations and those numbers are connected, so that you're not just calling one and not getting the other if you need it, or vice versa, but also to ensure that the information and data collection is being shared, as well as ensuring that the right people go out to the call. So those, we need to get more education around 988, and the state has been working to do that. I don't know if the federal government will support that, but it is something that we're working on.
Thank you for mentioning 988 as someone that's very much involved in the suicide prevention world on a local and national level. I'm grateful to hear that so much, and I'm always shocked by how many people do not know that number, and I appreciate the linkage between 911 and 988, because they operate as separate entities in a lot of places. So it's nice to know that there's a bit of a bridge there, where if somebody is presenting with a mental health crisis, that we can then transfer them to the right place that they need to go so they get appropriate services. So thank you so much for that. Anyone else wanted to add anything with regards to our current question before we get into our final question? You're ready for the final one? Let's go. We're all on the same page. Child Guidance Resource Centers has been advocating at the state level for a long time for increased mental health funding. So my question for you, esteemed panelists, is what kind of action do you think is needed to move this legislation along? What do we need to do to move legislation along?
I'm just going to jump in here really fast before any of our state people can, because I'm going to say something that several of them have heard me mention, and if my state rep, Leanne Kruger, was still here, she would roll her eyes at me. But I'm thrilled to see money going to mental health in the schools. But most of the mental health dollars, and children, like Child Guidance Resource Center works with the schools, but most of the mental health dollars that get sent out, and all of the mental health dollars that get spent on people without private means who age out of the school system are spent through the counties. And we have not seen any, I think the budget was cut for mental health under Governor Corbett, and it hasn't gone back up. There was a proposal pending to put in $100 million, which has gotten tied up going out to the states that was supposed to be ARPA money, which actually has a deadline on when we can spend it. It is very, very important that if we are going to be able to provide resources to those who do not have private means, and to be able to keep providers serving that population, we need that money. Because we need that money to increase what we pay, because what we pay is what allows providers, child guidance, others, to keep people in service to that community. So I'm just going to say, it needs to get passed.
So now we can hear from our state.
There we go, sorry. We are definitely trying to work collaboratively. Certainly, there are challenges within our own body on the state house side, and trying to make sure we have legislation that is going to make it through. It's never a done deal, just because there is a Democratic majority, and I think those of us still sitting up here know that's the case. I think there is definitely progress forward. At least there is attention to these matters, which I don't think was there in the past. And again, I would say the advocates are so important as we move these processes forward. So Christine, thank you. And you certainly are one of the biggest advocates, and we listen so much to our counties. But we really need, you know, as we pass things through the House, what we really need is for the Senate to take them up and to act on them. I mean, sadly, sorry, Amanda and Tim, we're not blaming you guys, but you know, the things that are moving through the House that are very positive are just not moving through the Senate. So, advocates, I hate to make your jobs harder, but keep advocating.
I think that, you know, with the senators here, of course, they're fighting a good fight. They're really in the minority, seriously. But, you know, on appropriations, where Senator Carney has been, he knows, he sees the money. And now that I'm on appropriations in the House, I see the money. And so we know that the money is there. As you hear Senator Vince Hughes always get to the mic and constantly talk about the money is there, the rainy day fund, and how much money we do have. So for the folks that are sitting in the audience and the folks who will watch this, understand that our state is in a good position. Governor Wolf put us in a good position, at least I think so. That's my opinion, for me to say, but I think he put us in a really good position, and I think we're in a position now where we do have the funding. But again, we're waiting on the Senate, and our colleagues here who are sitting here, they know that we can put this stuff into the fiscal codes like we have it. And so as long as you know that, I always tell people who come up to the Capitol, I'm like, you're in the wrong office. Let me give you a couple of numbers. So, you know, we already know, and so we just encourage you to continue to advocate in those offices where people are not planning to budge and that are holding up the process.
So I'm going to take my legislator hat off and I'm going to put on my public health expert. I have that hat on. I have a master's in public health. And I think one thing, since we're talking specifically about gun violence, and there's a lot of talk about mental health because of the Child Guidance Resource Center and all the work that you do in that space, that is what you do. I just want to remind everybody who's watching that most of the people that suffer from mental health issues, illnesses, are not violent. They're more often than not the victims of violence, whether it's self-inflicted by an act of suicide, or if it is an attempt at that, or what have you. Or it is other people perpetuating it on them. Unfortunately, when we do have these mass occurrences when it comes to gun violence, and it is somebody that's, also struggling with a mental health issue, we create this false equivalency that people struggling with mental health are violent. So I want to go back to and circle back to the things that Elaine has talked about the housing and the schools. We need to invest in mental health. I am not taking that away. Christine is absolutely right with what she has said. Like, that money is there, we need to be investing it, the adult population needs it. But if we're going to address the gun violence epidemic, we cannot understate how important it is to address other issues around the economy, green spaces, which I think is really cool, and I want to look into that piece. Those green spaces, talking about the environment somebody's living in, and that the literal physical environment. Is it safe outside for them to be there? What are their schools like? Do they have access to health care as a general statement? I actually heard a story where a child died by a gunshot wound, but the parents said it was asthma. Why was it asthma? They couldn't get their child to the doctor to get the treatments that they needed, so they missed too much school and ended up dropping out of school, got in the gang, and therefore asthma is actually the reason that their child died. So I just want to take it back to that as a public health expert, that when we're talking about gun violence, there is a whole foundation of things that we need to be doing, and talking about mental health is incredibly important, but talking about those other social determinants of health and investing in addressing those issues is just as critical.
Thank you. Thank you, Senator. There we go. I'm going to keep my Senate hat on, even though I'm by no means an expert in it. I would rather have my Phillies hat on. It's just real quick about the money. There's was mentioned about a rainy day fund. We have $5 billion in our rainy day fund. As a point of comparison, 4 years ago we had $250 million in our rainy day fund. In our general account, we have, depending on who you ask, probably about 8.25 billion, probably closer to 9, but it's just in our general fund in terms of revenue that has come into the state. And, you know, again, by point of comparison, the biggest surplus the Commonwealth ever had was during the Ridge administration, and it was about $500 million. A good question is why? You know, why do we have that much? Why do we have that money where it is? And it's because of federal money that came in to the Commonwealth that went directly into people's pockets. And checks were issued directly to folks, particularly middle income, lower income folks. And you know, during the pandemic, with the childhood tax credit, for example, we pulled more people out of poverty in Delaware County in a week than we had done in forever. And it was kind of an amazing thing. Of course, we shut the funding off after a year and dumped all those people right back on the other side of the poverty line. But the reason that we have the money that's in the general fund is because all those people that got that money came directly to them, they spent it. And they spent it, you know, in their local stores, in their local services, everything else. And those people who got paid for that work, they spent the money as well. And then those people spent it. And it keeps circulating and circulating and circulating. Every time that money circulates, the state gets a cut through the sales tax. So literally every single quarter for the last 8 quarters, we've exceeded our expected revenue, the money coming into the state. So we're sitting on this money and we're arguing in the appropriations and in the Senate about you know, being responsible stewards of that money, which I fully appreciate. But we're arguing over what is anticipated to be a financial cliff that's going to occur 5 years from now. And I ask, well, 5 years ago, did you have any idea where we'd be right now in terms of the dollars or in terms of how it kind of worked? And, you know, money in the rainy day fund, well, guess what, folks? It's raining. For an awful lot of people in the Commonwealth, it's pouring. And we could actually be doing stuff with this money. I'm trying to do my Vince Hughes imitation, but that's you know, we could literally be spending it and helping these folks, and we're not. And we're basically, you know, we mentioned education, and that just brings up the fact that everything is intertwined. Everything, no matter what particular thing we're pushing for, it's intertwined with 6 other things. It makes